friends, welcome to another video. My name is Amira. I'm a student Pilates instructor, and today I just wanted to show you some low impact exercises that will help in alleviating and managing lower back pain. We'll focus on mobilizing movements that help decompress the thoracic and lumbar spine, and we'll also focus on exercises that loosen up those tight lower back extensors. As always, if you feel any pain or discomfort while performing these exercises, please stop immediately and consult a physician. Please also consult a physician or a PT to make sure that these exercises are safe for you to perform. You don't need any equipment for this workout, just yourself and a mat. So go ahead and grab your mat and let's get started.
Alrighty, so first thing we're gonna do is start out in a quadruped position. So just getting on all fours here, hips in line with the knees, shoulders in line with the wrists, and then we're just going to tuck that pelvis under us. We call this a posterior pelvic tilt. And then we're going to return our pelvis to neutral. So we exhale, tuck the pelvis under us, and inhale to return our pelvis to neutral. And again, exhale, tucking the pelvis, and inhale, sending it to neutral. We've got about 5 more here. Exhale to tuck the pelvis under us, and inhale to send it back to neutral. And 4, feeling our abdominals contract and engage as we tuck the pelvis, and then feeling our back extensors pull our pelvis back as we send it back to neutral. And 3, last 2, and neutral. And last 1, exhale, tuck, and inhale, neutral. Now we're going to do the same thing, but adding the upper back component. So we exhale, rounding the spine, tucking the pelvis, and then inhale, extending the spine, looking forward, and slightly send the tailbone towards the sky. And again, exhale, rounding the spine into a cat position, and then inhale, extending the spine, slightly arching the back, but not too much on that arch. And again, we exhale, rounding the spine, and then inhale, extending the spine, looking forward. And about 5 more here. Exhale to round, creating that nice C curve in the spine, and then inhale to extend, looking forward. And exhale. And inhale. Maintaining pelvic stability and stabilizing the scapula throughout the movement through the spine. And last 2. And inhale, extend. And last 1, exhale to round. Inhale, extend. Good. Now we're going to go ahead and lower ourselves down onto the mat, making sure our feet are firmly planted. And we're going to do some more tilts of the pelvis in this position. So we're taking our hands in a triangle shape, and we're going to place that inverted triangle onto our pelvis. So we see when we exhale and shift our pelvis forward towards the sky, the part of the pelvis that shifts up is near the tips of the fingers. And as we inhale to shift the pelvis back towards the mat, creating a little bit of an arch in our back, the part of the pelvis that shifts up is near the thumbs. So we exhale to tilt up and inhale to tilt back. So exhale, tilting the pelvis up, contracting those abs, and inhale to tilt the pelvis back, slightly arching the back. And again, exhale, contract, tilting up, inhale, tilting back with a slight back arch. We have 3 more. Exhale, tilting up, and inhale back. And last 2, tilting up and back. And last 1, exhale, tilting up, and inhale, tilting back. And then we're going to return the pelvis to a neutral position. Now moving on to our pelvic curls, we're going to exhale and roll the pelvis and spine up as we articulate the spine, and then inhale, pause, and then exhale, we're going to roll the spine and pelvis back down And then inhale, pause. And exhale, engage the abdominals, rolling the spine up. And inhale. And exhale, rolling that spine down. Again, and we exhale. Start with lifting the tailbone, trying to peel each individual vertebrae off the mat one by one. Inhale and exhale, reverse direction. Last thing to touch the mat is the tailbone. And again, exhale, rolling the spine up. In this elevated position, make sure that your heels are being pulled towards your hand, engaging those glutes and those hamstrings. And then we exhale and roll the spine down. And again, exhale, rolling up. Try to make a diagonal line from your knees to your shoulders. Inhale, and then exhale, rolling the spine down and rolling through the pelvis. And again, exhale, rolling up. Inhale, and then exhale, rolling down. And then inhale. We're on our last good one here. So exhale, rolling the spine up, up, up. Inhale, and then exhale, rolling the spine down. And inhale, good. Next, we're doing our spine twist supine. So we're gonna get both legs up into tabletop, making sure that our pelvis is neutral and stable. Our lower back is connecting with the mat. So we do not want to arch our back here. Our arms go out into a T, and then we inhale, moving the legs over to one side, and then exhale, contracting those obliques to return the legs to the center. And inhale over to the other side, and exhale, pulling to return the legs to center. Keep the knees in line with each other as we move over to one side, and then exhale, engaging the abs to return them to center. And again, inhale over to the other side, and exhale, pulling the legs back with the abdominals to the center. And again, inhale over to one side. Make sure that the legs and pelvis are moving as one unit. And exhale, center. Inhale over to the other side. And exhale, center. And we have one more full set here. Inhale, moving to one side. And exhale, center. And inhale, moving over to the other side. And exhale, center. And we can go ahead and bring both of our legs down onto the mat and return our arms to the sides. And now we're going to move on to our glutes and hips. So lying on our side with our bottom leg in a 90-degree angle, we're going to go ahead and exhale, lift the leg, and inhale, lower the leg. Exhale, lift, inhale, lower. Lift and lower. Lift and lower. Here we're working our hip abductors as well as the muscles in our lower back and of course our core to keep us stable. We lift and lower. Keep your knees slightly bent to avoid hyperextension. And last one, and now we're going to move the leg forward to a 90-degree angle, lift the leg, lower the leg, and bring it back. So exhale, moving it forward, lift, lower, inhale, returning the leg. And exhale, lift, lower, inhale, returning the leg. And again, exhale, lift, lower, inhale, return. I'm going to keep the pelvis stable as we move the legs forward and back and up and down. The leg and foot are in a relaxed position. And return. Again, exhale, lifting, lowering, inhale, returning. And last one here before our next one, exhale, lift, lower, and return. Now we're moving towards our next exercise. So we exhale and just lower the leg, lower, and lower, lower, and then inhale, lower, 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 and return. Now we'll be working our adductors on the opposite leg. So we exhale, lift the leg, and inhale, lower the leg. Toes pointed as we lift the leg and lower, lift, lower, and lift and lower, and lift, lower. And last two here, last one. And now we're gonna change sides. So same thing on the other side. Our supporting leg is going to be 90 degrees. We exhale, lift, inhale, lower. Keeping a relaxed foot as we exhale, lift, inhale, lower, lift, lower, lift, lower, lift, lower. Last two here, lift, lower, lift, and lower. And then the next exercise, we exhale, lift, moving the leg forward, lower, and inhale back. Exhale, moving forward, lift, lower, inhale, returning. Exhale, forward, lift, lower, inhale, returning. Lift, lower, and return. Out, lift, lower, then return. Last three here, lift, lower, return. Last two, out, lift, lower, return. And last one, lift, lower, and return. Now the next exercise, we're going to exhale, just pulses down, lower, 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 and then inhale, lower, 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 and lower. And returning the leg. And then for adductors on the opposite leg, we're going to exhale, lifting the opposite leg, and inhale, lowering. Exhale, lift, inhale, lower, lift, lower, lift, lower. Using that arm for support, stabilizing that pelvis, also using our core muscles for support. And last one, lift and lower. Now we're going to position ourselves sitting on the mat. Legs out in front of us, feet are flexed towards the ceiling, and we exhale and roll down and forward. Inhale, pause, exhale, rolling up and back, sitting upright. Inhale, exhale, rolling down and forward. Inhale, exhale, rolling back and returning our spine upright. And again, exhale, rolling down and forward. Inhale, exhale, bring that spine back and sitting upright. We want to make sure that we keep the toes facing the ceiling to get that nice stretch in the hamstrings, maintaining stability in the pelvis and the shoulders as we articulate the spine up as if we're rolling up a wall and down a wall. And inhale and exhale, rolling the spine back up and upright. And last three here, exhale, rolling down and forward, getting that nice stretch, and inhale, exhale, rolling back and sitting upright. Last two, exhale, down and forward, inhale, exhale, rolling back and up. And last one, inhale, exhale, rolling down and forward. Inhale, exhale, rolling up and up. And turning the palms up towards the ceiling, out to the side. We exhale, rotate the trunk to one side, 2 pulses, and exhale, rotate the trunk to the other side. And inhale in the center, exhale, rotate to one side, inhale, exhale, rotate to the other side, inhale. Exhale, 2 pulses, inhale, exhale, 2 pulses, inhale. And again, pulse, pulse, and pulse, pulse. Keeping the pelvis and the legs stable. Move the head and the arms together with the trunk as we pulse to one side and pulse to the other side. And we have 3 more. Pulse, pulse, center, pulse, pulse, center, last one, pulse, pulse, center, and relax. And now we're going to move to lay on our belly in the prone position for our back extension exercises. So lying on the mat here with our arms down by our sides, we're going to inhale as we lift the trunk up and extend the spine, and exhale, lower the trunk. Inhale, lift, exhale, lower. Our toes are pointed, stretched long, and inhale up, exhale, lower. We want to imprint that pelvis and the hips into the mat and lower. Keeping our head aligned with our spine, keeping our legs together, keeping our abs supporting our movements, and lower. And last 3, inhale up, exhale, lower. Last 2, up and lower. Last 1, inhale up and exhale, lower. Now we're gonna go back in for another cat stretch because I just love these exercises so much. So we're lifting ourselves up onto all fours, assuming our position, knees in line with hips, shoulders in line with the wrists. We're gonna exhale to round the spine and inhale, extending the spine and looking forward. And exhale, rounding the spine, tucking that pelvis under us. And inhale, extending the spine and looking forward. Slight arch. Exhale, rounding the spine again. And inhale, extending the spine. And exhale, round. Inhale, extend. Try not to arch the back too much on the extension. We focus on that flexion here. Moving through the spine and slightly extend. And arch. And extend. Last 2 here. Exhale, rounding. Inhale, extending. Last 1, make it count. Exhale, rounding, deep flexion. And inhale, extending. And we're going to relax into our rest position. So just come down onto our shins and really extend and stretch the hands in front of you to get that nice stretch in the back extensors. Just breathe in for a couple of breaths here. Awesome job today. I hope this workout really helped. Really good for just bringing that mobility back into the lower back. And a couple more cycles of breaths here. Really take this time to think about all the lovely work we just did. A few more breaths. And we can come on up to a sitting position. Thank you so much for joining me today.
All right, awesome job. Thanks for joining me. If you found this workout helpful, then check out my last video that focuses on spinal mobility to bring more flexibility to the spine. And if you want to see more from me, hit the like button and subscribe to my channel for weekly videos. I'll see you soon. Bye.